My name is Piotr Kramars. I'm the Deputy Chief Scientist at the ECDC in Stockholm. We work very closely with our colleagues here at the European Medicines Agency, and it's my pleasure to present at this very important meeting. I will tell you a little about ECDC role, and then I will show you some update on the global and EU epidemiological situation. And then finally, I will show you some information about the current status of the vaccine uptake, about the genomic variants, and about the importance of so-called non-pharmaceutical interventions. A lot of what I'll be presenting comes from ECDC work as part of the public health emergency. We raised the level of alert to the highest second level at the beginning of last year already, and we've remained at that level since then. ECDC is an EU agency like the European Medicines Agency, and we are responsible for coordinating prevention and control of communicable diseases in the EU. And as part of this, we conduct epidemiological surveillance at the EU level. And for COVID, it means monitoring of case, death, testing rates, test positivity, which is like a proportion of all the tests that come out positive for COVID, and more. We also provide support to public health microbiology work of the member states. And as part of this, we issue guidance on rapid antigen test use or genetic sequencing. Based on all the information that we collect and expert considerations, we issue scientific advice about the optimal ways to combat COVID. And in that, we provide options for the member states to prevent and to fight COVID. And the member states choose the right options depending on their situation. We also provide direct support to member states when needed and when requested. And for example, now we are working especially closely with countries with a low vaccination coverage to help them change this situation. And finally, we provide preparedness support, capacity building, and health communication support. On the picture, you see our Emergency Operations Center. I myself am part of a roster of so-called emergency managers, and I work there from time to time on shifts as an emergency manager. Next slide, please. Let's start with a look at the global situation. This graph shows you the evolution of the numbers of cases over time globally, and you can see that the story is not over. We are going through another wave of COVID, and it's very much driven by what is happening in Europe, the dark blue bars on the graph. But compared to the previous waves, we have more effective tools, and especially we have vaccination, and we have to use it to the maximum potential. Next slide, please. Let's focus now on the situation in Europe. On this picture, you can see two graphs. The blue curve shows the behavior of the case rate, and you see the rapid increase in the recent weeks. And the green curve shows you the slow increase in the death rates. And this discrepancy between the rapid increase of the cases and slow increase in deaths is largely contributable to the use of vaccines. Vaccines do prevent transmission, as you heard, and an infection, but not at 100%. But they are very good at preventing death and severe COVID. And you can see it on this graph. Next slide, please. But the use of the vaccines is just one of the important factors that are driving the situation at the moment. And looking at the vaccination uptake, as of today, around 66% of the total population is vaccinated fully, and around 77% of the adult population, which means that more than 20% of the adult population for whom vaccines are available and recommended are not vaccinated. Secondly, what is driving the recent developments to a large extent is the spread of the Delta variant. The Delta variant, you will see on my next slides, is dominating in Europe now, and it's up to 60% more transmissible than alpha, the previously predominant variant, and alpha was already more transmissible than the original Wuhan variant. Finally, what we observed during the summer and shortly after was a widespread relaxation of so-called non-pharmaceutical measures. And these include things like physical distancing, face mask wearing, various hygienic measures. And this is also contributing to what we see now, all the increases and worsening of the situation. Next slide, please. So let's first look at the impact of vaccination. On this curve, you can see the evolution of death rates over time since the beginning of this year until now. And this is displayed by the different levels of vaccine uptake in different countries. And you can compare the steeply increasing curve on the top, the orange one. These are death rates in countries with the lowest vaccination uptake. And then you can compare it to the bottom of the graph, where you see what is happening in countries with the highest vaccine uptake. And you can see the difference. This is because vaccines prevent deaths, and you will see that they also prevent severe COVID on the next slide. So here you can see a similar situation when we look at the hospital occupancy over time. Again, the hospital occupancy increases or doesn't increase, the curves are quite flat when the vaccine uptake is the highest. Next slide, please. Here you can see similar picture when you look at the intensive care unit occupancy over time. And this is very important. As I said several times, the vaccines are very good at preventing severe COVID, hospitalizations, intensive care admissions, deaths. It's important because this saves lives and protects health, but it's also very important to protect the healthcare systems and the healthcare workers who are under a lot of pressure, and this pressure has been increasing in the recent weeks. Next slide, please. No single parameter can reflect the situation, the pandemic situation at this stage of the pandemic. And at the CDC, we use now a composite indicator, which combines case notification rates, test positivity, situation among the elderly, situation in the hospitals, and death rates into one indicator. And the darkness of the color corresponds to the level of concern in the situation. When you move from the west to the east of Europe, roughly, you can see that the situation worsens and the level of concern increases. You can see the evolution of this indicator at weekly intervals. We update these graphs on Thursdays. Next slide, please. And you can compare it now to the vaccine uptake. You can see now the level of vaccine uptake in Europe. Again, moving from west to east, roughly, you can see the vaccine uptake gets lower. And it doesn't take much time to see the correlation. The higher the vaccine uptake, the lower the level of concern with the current pandemic situation. Next slide, please. You probably noticed on my previous slide that I showed you the status as of November 14, but it doesn't change very much. You can see here on this graph the behavior of the vaccine uptake over time in different age groups. And you can see that after a slow start at the beginning of the year, when there were a few doses available, then there was a period of quite rapid increase. But in the recent weeks, there has been a plateauing of all the curves, almost all of them. And it's very difficult to move even by 1%. And this is very worrying. Next slide, please. Another important factor that is driving the recent developments is the spread of the Delta variant. Monitoring of genomic variants of the virus is extremely important. This virus mutates as all coronaviruses do. It changes and new variants emerge. And it's very important to detect early any new variants with changed transmissibility or severity of disease or effectiveness of vaccines or medicines. The capacity for such monitoring varies quite a lot across the EU, but it's increasing, and we at ECDC work very closely, on the one hand with the European Commission, and on the other hand with the member states to improve the infrastructure and to train personnel so that this capacity for genomic monitoring increases, and it will be used not only for COVID, but hopefully in the future for other pathogens. Based on all this monitoring, we can see that the Delta variant is now dominating Europe. It evolves further, and there are some sublineages which we closely monitor. One of them you probably heard about is the AY 4.2. It has slightly increased transmissibility. It doesn't seem to cause more severe disease or escape immunity. But it's extremely important to reduce the viral transmission at the moment and the viral spread, because the more of this spread, the higher the chance that a new variant with some dangerous properties will emerge. Next slide. And you can do this on the one hand through vaccination, but on the other hand through so-called non-pharmaceutical interventions, such as physical distancing, mask wearing where indicated, hand hygiene, etc. We have increasing evidence that they work. They work not only for COVID, for the SARS-CoV-2 virus, but for other respiratory viruses like the influenza virus. But their effectiveness depends on how early and how swiftly they are implemented. And when they are implemented, they have to be accompanied by clear risk communication to explain to the population why they are introduced, based on what parameters, and when they will be lifted. Community engagement is key here. ECDC, together with the Joint Research Center, maintains a database of measures of these non-pharmaceutical interventions implemented by the member states. And when we looked at this database, we noticed that at the beginning of November, overall fewer measures were in place when compared to the situation a year ago at the same time or 6 months ago. And also this is driving the current developments. Next slide. So I would like to leave you with 3 key messages. The first one is that the highest priority is the continued effort to increase vaccination coverage, to vaccinate those for whom vaccination is recommended and who are not vaccinated. We have to close the gaps in vaccination everywhere. Secondly, EU and EEA countries should consider a booster dose for adult population, especially those 40 years of age and over, targeting first, of course, the most vulnerable and the elderly. And finally, even in countries with high vaccine uptake, maintaining or reintroducing the non-pharmaceutical measures remains vital to reduce transmission. We are approaching now the end of year festive season, when people will be traveling, they will be shopping, they will be meeting with their families, their friends. And applying these measures will help control the spread of the virus, and we will protect the health and the lives and the healthcare systems functioning. Next slide, please. We've observed during this pandemic an unprecedented spread of misinformation and disinformation. In fact, the next presentation will be about this. And the best way to address it is to spread facts, factual information, and evidence-based information. And I would like to encourage you to visit these links and help us review the information there and help us spread this through your networks, starting with the rapid risk assessment that we just published yesterday on our website. And I presented you some elements that come from this rapid risk assessment, but you have much more there. So please start with this first link. Next slide, please. Finally, I would like to acknowledge all the member state experts with whom we work, who submit the data that we analyze and that I presented to you. And they also help us with our scientific advice development, and all the ECDC colleagues with whom I have a pleasure to work. Thank you very much.